All right, so welcome back, everyone. Yours truly, Dr. Pierre. Welcome to another edition of the weekly Real Physician Reacts, Dr. Reacts. This week, this was a highly requested topic. We are talking about high blood pressure. If you're catching the podcast episode tomorrow, whenever you catch a podcast episode, I definitely suggest you join us here on TikTok to get any questions or comments responded to. Tonight we are talking about high blood pressure. I have an article from I think it's from the American Heart Association, why high blood pressure is a silent killer. Now, I can tell you, as a practicing physician, as a pre-med student, medical student, this is what we always refer to as high blood pressure. Like high blood pressure, silent killer. Like the two things just kind of went hand in hand. And of course, when I'm a pre-med and I don't know any better, I'm like, why do they call high blood pressure a silent killer? Like, why is it like, especially because we talk about it all the time. Like, it's probably one of the most talked about diagnosis that you know. Every time you go to the doctor's office, guess what's one of the things they're likely going to do? They're going to check your blood pressure, right? So it's not like we don't know about blood pressure. So it's not like it's some obscure disease that, 1 in every 10 million people get it. No, this is an extremely common disease. But even as extremely common as it is, we still refer to it as the silent killer. So like I always do with these weekly episodes, I like to kind of start with a personal patient story so you can kind of get the idea of the significance. So here I have, when I was an outpatient doctor taking care of a 34-year-old gentleman, 34-year-old, worked out 4 times a week, extremely fit, right? Like just one of those muscular build type guys. And he came to the office because he was just kind of having headaches and didn't understand why, especially when he went to the gym. Now, when I tell you, when the second my medical assistant checked his blood pressure, she was shocked. And she doesn't get shocked a lot. Like, she's seen it, she's done it. He walked in with a blood pressure over 200. Now, again, and a lot of times I know, especially when you go online and people see people who are typically overweight, they always say, oh, man, you got heart issues. Like, they always kind of blame that, right? Hey, how's it going? Thank you for joining. But here, this guy who, from the outside looking in, looked fit. He muscular, short sleeve shirt, all of that. And he was a walking time bomb. He had no clue. And I asked him, of course, which I always ask, oh, have you ever checked your blood pressure? Is that the thing you don't normally do? And of course, just like what most people do, especially in our 30s, because if we feel fine, then we are fine, especially for my men. I spent a whole month talking about Men's Health Month. If we feel fine, we are fine. So, of course, he never came to see us, never stuck his hand into the pharmacy and checked his blood pressure, didn't do any of that, because for his eyes, he was like, nah, I am good, right? But here we go, right? I'm checking his blood pressure. No, I don't. Someone asked if I had blood pressure. I do. Thankfully, I don't. And we'll talk about that, a couple of reasons why. So, blood pressure 200. Now, of course, first things first, I got to decide if I'm going to send you to a hospital right from my office. Like, that is how severe it is. And of course, in his mind, he's like, all I had was headaches. Like, I'm okay. And I'm like, no. Like, you are about to either have a stroke or you're about to have a heart attack. One of these things are about to happen if we don't do something ASAP. Now, typically in most outpatient doctor's office, we have a medication called clonidine. We'll talk a little bit about it. But it's a medication that we give when we need that emergence. Like, we need to emergently bring your blood pressure down. So we give you the clonidine. So we gave him the clonidine, sat his blood pressure. It got down to about 180. And he was feeling a little bit better. But I still sent him to the hospital because I'm like, if your pressure is spiking up in 200s, that's a problem. And someone asked, Indian Lover said, hey, what number is high for blood pressure? So in the textbook, I'll just bring out the textbook. The textbook way to think saying, if your blood pressure, top number, which is what we call the systolic, is above 130, or the bottom number is above 80, you have high blood pressure. So that is the textbook way of looking at it. Above 130 for the top number, above 80 for the bottom number, you have high blood pressure. Now, of course, there are other people who they typically live in a blood pressure in the low 90s, 100s. If their pressure shoots up to like 125, 130, they may feel a problem in and of itself. His the guy's blood pressure that I was referencing came in at 200. We were able to give him medication to bring it down to 180. Bring it down to 180, felt comfortable enough where he said, okay, now we could probably send you to the ER and feel comfortable that you're not about to stroke out right now. Because this is why, especially when we talk about blood pressure, why we consider it the silent killer. Our body does an amazing job taking care of blood pressure, an amazing job. It will let you go to 130, 140, 160. It will let you go that high, and then they'll just say, hey, you know what? I'm cool. Like, I can't do this anymore. Boom. And once it gets to that point, guess what happens? You have the stroke, you have the heart attack. Now, of course, those are the worst case scenarios. A lot of times as you're going through the climb, you may have some shortness of breath. You may have some chest pain or chest discomfort. You may have some headaches or dizziness. You may have some telltale signs that are saying, hey, I really can't deal with what I'm having to deal with. But a lot of people just kind of either brush it off or, again, they're symptomatic, aka silent killers, so they don't really pay it any mind until they see me in the hospital after their first heart attack. So it is one of those things, especially when we talk about blood pressure, and we'll give some numbers, right? Because I like to give numbers to keep people in perspective of what we're dealing with, right? Globally, 1.13 billion people have high blood pressure. 45% of people in this country have high blood pressure. But so think about that. 45% of people in this country have high blood pressure. Only 25% of those people who we know have high blood pressure actually have it controlled. So 45% of the country, that's about 108 million people have high blood pressure. About 25 to 33% of those people actually have blood pressure that we would consider controlled. And then there's a segment of the population who are walking around, and some people may know some of these people. Some people may be aware of some of these people who are walking around and have no clue that their blood pressure is high. Again, so we don't have to tell on ourselves here on the live tonight, but like, when's the last time, like, y'all checked y'all blood pressure, right? I'm seeing someone said 135 or 78. I like that. Someone said they were diagnosed at age 25. Thankfully, control the meds. We love that. Appreciate it. There's a lot of people walking around here who have no clue what their blood pressures are. They're just kind of just wandering out. Like me, I can't go past a pharmacy and not put my hand in there, right? Someone says, please don't give medical advice if you're not an MD. I 100% agree. In fact, even if you are an MD, right, be careful with the medical advice you give online, right? Because people may use it against you, right? I'm not sure she realizes that I'm a physician, but I'm assuming she's just talking in general. Someone says that they were diagnosed at 35. Someone says me and Miss Amlodipine. Hi, Dr. Dooley. Me and Miss Amlodipine are longtime friends, and Amlodipine is a great blood pressure medication. It's a great blood pressure medication. And what do I classify as great blood pressure medications? Medications that are easy to take, either one time a day, twice a day, and more importantly, medications that are cheap. Because it's one thing to have the best medication to treat whatever disease I'm talking about. If that medication costs you an arm and a leg, and you got to decide whether I'm going to eat dinner, feed my kids, or take the medication, like I'm gonna eat dinner, right? I'm gonna feed my kids. So whenever I can get a medication that works amazing and is cheap, which means the general population can take it, I'm good for it. We got hydrochlorothiazide being said here. Someone said, old school blood pressure reading at Walgreens, definitely. Someone says, because you said BP was 180. Yeah, we're talking about the systolic, no conate, or top number for the layman's people. Valsartan, that's another good one. Can cause labor. Oh, so let's talk about this, right? So let's talk about, because I see people are asking about like some causes. So when I'm thinking about blood pressure, I split it up into two different categories when I'm explaining it to my patients. Causes that you can change and causes you can't do nothing about. Right? So let's focus on the causes you can't do nothing about. Age. We know that age is a significant risk factor. The older you are, the more likely you are to have some blood pressure. But we're seeing, if you look at these comments, some people are getting at 25, 35, 36. Like, it is not an old person's disease. And that's what I really hope to get us out of that. Thinking that this is when we talk about blood pressure, diet, this is not an old person's disease. Even though, mind you, I just turned 40, right? So I'm at the age now where I can look at, I'm looking at other folks like they're the young whippersnappers, right? Like, y'all youngins don't know. Back in my day, I'm at that age, which is kind of funny when I think about it. Oh, shout out to Listen to Prayer, that was a good one. So it's not an old person's disease. Right? This is not a disease that you can walk around in your 20s and 30s and think everything is cool. I'm going to wait till I'm 40 to check my blood pressure, to check my, no. We got to attack this ASAP, for sure. So we talked about age, gender. We know that men are more susceptible to dealing with high blood pressure than women up until a certain age. So up until a certain age, and we typically are around 55. So around the age 55, we kind of see that trend of women dealing with high blood pressure much more frequently than men, right? And for guys just kind of understand why. What happens in the 50s for women that make it so that they're more susceptible to dealing with high blood pressure, right? And that's the menopause, right? So menopause around that age is because estrogen is very protective. You tend to have some barrier, but once you lose it, right, you kind of start catching up to the men. Age, we talked about age, we talked about gender, race is a big one, right? Me being black, right? Now it's a whole other host of factors, but race plays a significant factor of whether you're going to deal with blood pressure issues. And the biggest as far as when I talk about race is the addition of genetics. And you'd be surprised how many people deal with diseases, whether it be blood pressure, cholesterol, cancer, whatever the thing is. And it has nothing to do with what they're doing, but what is in their family history. So a lot of times when we're talking to our patients, we're trying to figure out, hey, how was mom? How was dad? How was grandpa? How was grandma? We're trying to figure out the family history because we know, right, that the family history plays a significant factor in dealing with diseases in and of itself, especially at the age you may deal with it. So I'm seeing a lot of people are mentioning some of the causes we can deal with, right? So what are causes we can deal with? Diet obviously is going to be a big cause of a factor associated with high blood pressure, especially salt intake or just the types of food, but definitely diet playing a factor. Obesity, I separate diet and obesity, right? Because like I said, my patient was a skinny, fit guy, right? But he had some genetic issues, right? So diet wasn't really his issue. Obesity wasn't really his issue, right? But he had a lot of weight. We know increased weight can also play a factor in dealing with high blood pressure. Cigarette smoking. Now, if you don't get nothing from me today, there's literally no benefit to cigarette smoking. Any disease you can think about, cigarette smoking makes it worse. I don't know how these folks are still, I know how they're still around, but cigarette smoking is just bad for your body. There is no silver lining for cigarette smoking, right? So cigarette smoking, get that up out of here, please, right? Because that's so much of a specific factor, right? So diet, exercise, or lack of, right? A sedentary lifestyle plays a significant role and significant factors in our blood pressure and our control of blood pressure, right? So when we start thinking about things we can change, things we can address, I always have to separate, hey, a lot of your issues fall on the stuff that you really can't do nothing about, right? Your age, your race, your family history, you really can't do nothing about that. So we gotta factor on stuff what we call the modifying issues, right? We can modify our diet, we can modify our weight, we can modify our dietary intake, we can modify whether alcohol use, that's a big one, cigarette use. Those are things we can kind of change. We can't really change stuff on the left hand column here, right? That's really the big issue at hand. So you have this, we have our causes, right? So we know hey, these are some of our risk factors associated with dealing with it. Now, of course, diagnosis is easy, right? Diagnosis is you're going to see your doctor. Someone mentioned earlier, I wish I would have highlighted it, and he kind of mentioned a good factor of white coat, right? White coat syndrome, aka because this is not some made up thing, right? There are a lot of people that just the thought of going to see the doctor raises their blood pressure up. Think about that. Not even getting into the doctor's office. Like, you're not even at the doctor's office yet. Just you saying, oh man, I got to go see my doctor. I don't know what Dr. Pierre about to tell me. Like, he may tell me I have cancer. I don't know what he's about to tell me. Just that thought alone has people blood pressure rise. So I'm big on, if I see your blood pressure on the high normal side, especially when I was doing outpatient medicine, I say, hey, well, you know what I need you to do? I need you to go to Publix, right? I need you to go to Walmart. I need you to go to Walgreens. I need you to go to these pharmacies. Check your blood pressure when you're at home, when you're away from me. Like, let's get a quick little journal, maybe a 3 to 5 day journal of what your blood pressure looks like away from the doctor's office. Because if it's high in the doctor's office and it's high over there, all right, you got high blood pressure. Like, we can't really go from that, right? But if it's high at the doctor's office and it's normal, like consistently normal outside the doctor's office, then I can say, all right, you may be having what we call white coat hypertension. And I have to, obviously, I let my MA know that, I let the people know that I put in your chart, so we don't go crazy giving you medications that you don't necessarily need, right? So extremely important from that perspective there. Let's see. Let me make sure we catch up on I appreciate all the comments. It's seeing a lot of people here. A lot of people are checking their blood pressure. I love to see it. Oh, Valsartan, that's another one. We'll talk about the different classes of medications here. Let me see here. Someone said they syndicate 500 newspapers. DM me. Someone said they write for 5 newspapers. They want me to write for them. Well, I let it write. Lisinopril is not good. I had a reaction to it. Ooh, so let me highlight this, right? And we'll like I said, we're gonna talk about medications. But someone said, like, hey, lisinopril was not good for me. I had a reaction to it. Swollen lips. So if I have any pre-meds med students on the live, you already know, right? When we talk about medications and we talk about reactions, especially blood pressure medications, that is classic. That is like, I'm going to see this on a board exam classic. Hey, I took a medication in this class, which is lisinopril, the class that lisinopril is in, and I came back with either a cough or I came back with swollen lips, swollen throat. So it is and I don't want to say it's a common reaction, but if you tell me you're on a blood pressure medication that causes your lips to swell, I'm going to likely guess lisinopril. Like, that is how those two kind of go hand in hand. And there is a propensity for people to have these types of reactions. And it's not like off the first go. It's not like, oh, I took it once and then it happened. Some people could be taking that medication for weeks, and then all of a sudden, boom, it pops up, right? So I do love that you pointed it out, because that is a very common thing. Someone said, I've been 150 over 90 for the past 20 years. I believe each person's DNA is different, no med issues. So someone said, their blood pressure has been 150 over 90 for the past 2 decades. I believe each person's DNA is different, no med issues. So again, you have some people who live on the low to normal side. Now, I would argue, right? Our body does a great job. So your body may be able to deal with that blood pressure being 150, 190 for quite some time. But one day it may not be able to deal with it, right? Now, would I be telling you to get on a medication that automatically drops your blood pressure down to 110 over 70 tomorrow? No. Because what typically happens is, once our bodies get kind of used to dealing with high to normal blood pressures, like, that's what it's used to. So if I turn around and drop you to a low norm, which is really a normal blood pressure, right, per se, we look at the textbooks, right, you're not going to feel as great because your body's used to dealing with that. So again, it is something I would keep an eye on. Right, but as long as you got good follow up, your doctor's keeping a good eye on you, I'm okay with that from that standpoint. Yeah, someone said too much salt. Indeed, too much salt, and then we kind of mentioned the diet aspect of it, following up with blood pressure. When I say too much salt, there are some people who, yes, their dietary intake causes them to take in too much salt. And what does too much salt do? Too much salt causes us to retain fluid. And if we're retaining fluid, guess what? Our blood pressure rise. Now, there are other people who, from a genetic perspective, you can have the same amount of salt content as someone else. Let's say 2 grams of salt intake as someone else. But for some reason, there are genetic factors where that if I take 2 grams, it affects me more. It causes me to retain more fluid. It causes my blood pressure to rise more than someone else who also takes the 2 grams. So yes, Salt, 2 grams is low for everyone who may not realize. Again, I don't know if people realize. Like again, and I'll tell you, I'm not a nutritionist, but I think a lot of people would be surprised if they factored in and counted how much salt they actually take in on a daily basis. So like a 2 gram diet of salt is a low salt diet. Like that's what we consider a low salt diet. So, but there are some people who just don't react well with having salt intake in their system, right? It is unfortunate from that perspective there. As someone says, cayenne pepper daily in water helps high blood pressure. So, and one thing I love about blood pressure, right? One thing I just love about medicine in general, right, is there's never one specific way to do things for the most part, right? And when we talk about the dietary aspect of blood pressure, we understand that there's a lot of medications out there, and there's a lot of nutritional supplements out there as well that help, right? And I'm always listening to both, right? Because no one will know more than your patient in how to control their blood pressure. Like I said, I can read the textbooks all day, but if your patient says, "Hey, every time if I take magnesium nightly, my blood pressure drops," I'm rocking with them. Like I'm like, all right, cool, you got that from that perspective. So it definitely is interesting the different ways you can work and control your blood pressure. Now, I'm not sure how cayenne pepper may necessarily help, but if it works, right, we like to do the stuff that actually works for sure. Let's see here. Lucky Aurora Star says, I gotten serious about my health. I'm down 30 pounds so far. I lowered my blood pressure. Amazing. And first of all, congratulations. Congratulations, right? One, just taking yourself and your health serious. Like, I think that's more important than anything else, right? Because and again, it's the triggers is different for everyone, right? Some people are just kind of just naturally motivated to always be about their health. Some people, they see their family members, deal with illness. They don't want to necessarily deal with it. Some people have an illness affect them. You'd be surprised the amount of patients I take care of that after their heart attack, they turn into like this health machine and they're the best person you ever seen, right? So sometimes it takes different events, but I'm glad that, you said, I'm going to take my health serious. I'm going to lose this weight. And then as a byproduct, right? And that's the beauty, right? As a byproduct, your blood pressure improves. Right. As a byproduct, your risk for heart disease and everything improves because you're dealing with the weight. Right. So I definitely want to make sure we give a shout out for that. Eat your fruits. Yep. Because it says eat your fruits. They heal you from high blood pressure. Right. Some of them will do a great job. Right. And again, when we eat the fruits, it's getting one of those things where, all right, if I'm eating more fruits here, that means I'm eating less foods that are likely attributing to my blood pressure. Right. So again, and this is one thing I think a lot of times, especially now, physicians get this very bad rep about not wanting to like focus on nutrition or stuff outside of, pharmaceutical related medications. Right. Anything that you can do, right, to avoid me having to prescribe you medication that's actually beneficial, I want you to do it. So yeah, definitely eat your fruits for sure. I see someone mentioned magnesium and beet juice. Shout out to that. Let me share. Make sure we don't. Let's see. Living Life says, and this is a good. This is a good comment, right? Pharmaceutical companies are driving what is considered normal, right? So now let's break it down, right? When we talk about this aspect of normal blood pressure, so first and foremost, heart disease. Heart disease is and has been the number one killer in the world for decades now. One of the diseases that are associated with heart disease, and one of the biggest ones, is high blood pressure, like direct correlation, high blood pressure, stroke. And when you look at our top 10 causes for death worldwide, high heart disease is like number one. I think stroke is like 5 or 6, and it's in that range from that perspective. So a lot of times we just look at the like sheer raw numbers, right? So, and when I was a medical student, and I kind of mentioned as far as what normal blood pressure is, right? Normal blood pressure is blood pressure less than 120 for top number, less than 80 for the bottom number. And we start considering you having high blood pressure if it goes up to over the 130, over 80. But when I was a medical student, that number used to be over 140 and over 90. Right. And so you're asking yourself, hey, Dr. Barry, like, why did they change it? Right. Why did they decrease the threshold, which of course would make more people become hypertensive? Because if you were 130 over 80 when I was a medical student, we didn't consider you having high blood pressure. But now that I done moved the threshold down, guess what? Now you're in a high blood pressure. And the reason why they did that is because one, right, and this may not startle you. Let's see how much. Think about it. High blood pressure costs the United States $131 billion every year, which means dealing with the effects of uncontrolled blood pressure costs the United States $131 billion a year. And one thing medicine is good at is spending money at the tail end. So instead of taking care of business in the beginning, making sure people are eating fruits and vegetables and exercising, doing all the stuff in the beginning when it's cheap, even though if you ask people like to go shopping and get a shopping cart full of fruits and vegetables, all that stuff, they'll tell you it's not cheap. And the stuff that is cheap, again, tributes to the blood pressure, right? Again, that's not a pharmaceutical thing. That's just if we can open our eyes, this is what we're seeing. So you have this issue here where it's costing the United States a lot of money to deal with the effects of high blood pressure, right? So we need to catch these people earlier as possible, right? So the guidelines move down so we can try to catch these people much earlier. So I wouldn't say it's necessarily a pharmaceutical industry driving it. It's more of like, hey, we are spending a lot of money dealing with this issue, and we need to catch these people sooner, right? So it's more, right, of a capitalistic issue, right? And anyone who's followed me on this channel before, first of all, make sure you follow me. You know that I talk a lot about the capitalistic motivations associated with medicine. Let me see. Let's see. Someone says shout out to cranberry juice. Cranberry juice is getting a mention here. Garlic definitely getting a mention. CoQ10. I haven't seen that mentioned yet. But CoQ10 is definitely an aspect of there. Someone said a lot of frozen foods. Oh yeah, frozen foods. Well, if you think about it, right, for frozen foods to be frozen foods, they have to be preserved, right? And if the remedy or the ingredient that needs to preserve tends to be kind of in that salt driven, right? So that's why you tend to see that play a factor there. But very good. I got my vegans in here. Preserved, canned foods, frozen foods, all in that same boat. So what you'll see now, it's much easier for me, the physician, to be like, oh, get away from frozen foods, get away from canned foods. But if you're working with, a set level of finances, the frozen foods and the canned foods are cheaper, right? So yeah, it's cool, Dr. Barry, to be like, hey, don't do the frozen foods and stuff, but someone got to pay for my food. Like if I'm a senior citizen, right, I need to pay for food. Like go to y'all grandparents' house, right, and see what they got in their cupboard, right? Plenty of canned foods, plenty of frozen foods, right? Because it costs money, right, to actually get foods that are fresh and everything else. It costs money to get vegetables. It costs money to get fruits, right? So it's easier for me to be like, oh, just eat the good stuff here, the fresh stuff. But I live in reality as well too. Let me see. Oh yeah, a lot of teas are definitely I've seen beneficial. A lot of my patients will recommend it. Someone said they've been checking blood pressure 140 over 90. Yeah. So again, 140 over 90. That's that. When you get to the point where your blood pressure is 140 over 90, or really, that's when you say, oh, you definitely likely need at least one medication, as well as changing the modifying factors, right? So when we're talking about treating blood pressure, before we start listing medications, I say, hey, I need you to see if I can help you address the things that we can adjust, like diet, exercise, the types of food you're eating, like smoking, alcohol. Let's see if we can adjust those things there. And then let's add a medication on. If never, let's just add a medication on, because I can add a medication on, but if the stuff on this side, the diet ain't right, the weight ain't right, you're still smoking, you're still drinking, it ain't gonna matter. It ain't gonna matter, right? And now, and I'm just talking about the things that affect. Now, there's other diseases that will also cause you to have high blood pressure as well, right? And that kind of goes hand in hand when we get to that final point of like heart disease being number one killer, stroke being number one, like top 5, top 6 killer. Right? Because if you're diabetic, you can have high blood pressure issues. If you have kidney issues, you can have high blood pressure issues. If you have issues with your thyroid, you can have high blood pressure issues, right? So it's not necessarily a direct line of sight as far as like, oh, you have this, now you have high blood pressure. You can have a disease process that causes you to also have high blood pressure as well, too. So and again, when you have a good doctor, right, your doctor's going to map out this whole process of all of the things affecting your blood pressure. right? Because it's usually not just one from that perspective there. Oh, Harper says, hours before our son was born, blood pressure was 289 over 210. And I know Dr. Dooley's off here, but that is, right, hypertensive emergency. It's not uncommon for our pregnant patients to have significant uncontrolled blood pressures to the point where that baby's got to come out now, right? Like that blood pressure alone is enough, especially depending on the time, is enough for the OB to say, hey, you need to go to the hospital or that baby needs to come out, right? Because a lot of times the baby is a primary factor of why that blood pressure shoots up. And then once they get the baby out, blood pressure goes back to normal. So I'm definitely glad, or hopefully you're glad. Hope you're okay from that perspective there. This is a good question, right? And then we can kind of lean into some of our prescribed medication, right? So Valsartan and HCTZ. So this is 2 medications. Now let me show you how bad it's gotten in this country, right? I read some of the numbers as far as blood pressure is concerned. It's gotten so bad in this country as far as high blood pressure is that one medication ain't good enough no more. Right now, if you walk in, you have high blood pressure, it's borderline, let's say 140 over 90, like we kind of mentioned earlier, I could probably get away with starting you on like HCTZ, right? That's what most people know it as a water pill. I can get away with giving you a water pill, right? And why is the water pill great? Right? Because we're going to get water out of your body, right? If we get water out of your body, guess what? We get salt out of your body. We get salt out of your body, guess what? Blood pressure drops. So that's why a water pill is amazing. Now, the thing that happens is, let's say your blood pressure is so high that, you know what, that one pill is just not good enough no more. Right? Now I got to give you a second pill, right? Valsartan. Valsartan is a very common combo medication. And I kind of mentioned, especially when it comes to just taking medications in general, the easier you can make it for your patient, the better. Right? So instead of me having you to remember to take 2 pills at the same time, I say, hey, you know what? Take this 1 pill, and I got 2 medications in 1 pill. Right? So I'm able to kill 2 birds with 1 stone. I'm able to get 2 medications in your system, and because you only have to take 1 pill, it's usually much easier to remember. Because remember the numbers. Out of those of high blood pressure, only 1 in 4 have it under control. Reason being is that you may end up having to take 1 or 2 different blood pressure medications. Some people are taking 3 different blood pressure medications. Yes, the blood pressure is that bad. And 1 is in the morning, 1 is in the morning, afternoon, at night. 1 is only at night. Like, you can see how easily, and again, obviously if we're young, we're smart, we're sharp. Of course I would remember to taking it in the morning, afternoon. But what happens if you get busy at nighttime? What happens if you're rushing in the morning, right? And you forget to take your morning blood pressure, right? It's very easy to miss a blood pressure medication. So anytime, like I said, that combo drug that Mr. Tommy was taking, anytime you can get a combo drug off, we try to do it because we know that helps. That helps increase your compliance. And we know 2 medications will definitely help, will definitely help bring that blood pressure down. Someone said, let me go eat a banana. What's my alma? I'm from Florida State for undergrad and Nova Southeastern for medical school. Someone's asking what my alma mater was. Someone said this is scary. No, it's not scary talk, right? This is, someone said this is scary talk. No. This is just, we got to make these conversations so just like, blood pressure. Yeah, I check my blood. We got to make it so common, so relaxing, right? So to check your blood pressure next time you go to Walgreens or CVS or Publix, or depending on, I'm in the South, so we got Publix down here. I'm not sure what y'all got, where y'all at, right? We got to make these conversations very common, right, to speak of, right? We can't be scared of blood pressure, right? Why? Because it's a part of attributing to the number 1 killer for the past couple decades, right? Heart disease has been kicking butt for the past couple decades, even probably longer, right? And blood pressure has played a significant factor. So we got to make talking about a high blood pressure fun, because once your blood pressure is controlled, there's nothing you have to think about, right? And again, it's kind of going back to that silent killer. One of the issues that occur is that, let's say you walk in, your blood pressure is high. I give you medication because, hey, your blood pressure is high. But you're like, doc, I don't even feel nothing right now. I said, I know you don't feel nothing, but you may feel something in 10 to 15 years. Like, all right, cool, doc. You take the medication, and the medication will make you feel no different, except that when I check your blood pressure is great. Guess what? You're going to be like, all right, I take this medication, I don't feel nothing. I don't take this medication, I don't feel nothing. You know what? I'm not taking this medication no more. Boom, you have a heart attack and stroke, right? Not to say that it happens like that, but that is how that cycle typically occurs, right? When you're dealing with, let's say, pain, let's say, oh, your back hurts. When you're dealing with back pain, you know that, hey, once I take a medication, I no longer have back pain. I feel good. So you kind of respect back pain a little bit more. But when it comes with the blood pressure, you don't typically respect blood pressure like that because, as long as it ain't, crazy high, like, that top number in the 180s, 190s, 200s, you don't really feel a difference until you go into the doctor or you're going to the hospital because you got a heart attack or a stroke, right? And you don't want to do that. For the aspect of that. Let's see. Let's see. We want to make sure we don't miss anything. Oh, hey, Millie's on the live. Appreciate you. Someone said, honestly, I'm not sure what someone asked, what does the Amish do for high blood pressure? I'm not sure what the Amish does for blood pressure. Especially because, I don't know how good our numbers are as far as documenting like how their blood pressure is. So that's something I have to look up to. Per the FDA, disease can be treated with medication. No, I don't think so. I do not think so. Yeah, preeclampsia. Yep, someone mentioned it, preeclampsia. Yeah, when you're pregnant and your pressure rises up to that level, you are not even, at that point, you're not even you're eclamptic. It's like something is happening ASAP. Something is happening ASAP, and we need to take care of it ASAP for sure. Someone says, I'm in medical school starting clinicals next month. Hey, congratulations. Congratulations, Red Yada, starting clinicals. Clinicals is the best. Let me tell you, right? Well, a quick little side note. As a medical student, I tell my medical students all the time, the best time of your medical school life is your third year of medical school, right? Or however that works when you're starting clinicals. That clinical year, when you're just kind of going through, 1 month you're a family med, 1 month you're a internist, 1 month you're a surgeon, 1 month you're an OB, 1 month you're, ER, whatever that thing is, best time of your life. Fourth year sucks. Fourth year sucks, right? Because you decide, hey, I want to do X for the rest of my life. So then you go through like 4 or 5 months of rotations where I'm only doing that. And you have to be on your A game because you think if you miss one PIM question, you're not going to be in our residency. So enjoy your clinicals. The best time for sure. Let's yes, red yeast for rice for cholesterol, indeed. Let's see here. Make sure we don't. Yep, canned foods are definitely high in sodium for sure. Yeah. And I like. And thank you, Nicole, for mentioning that. There are definitely some canned foods that are low in sodium, and you have to be. And that's why it's about intention, right? So if you have family members, if you have patients who like that's how they get down, right? They gotta eat something. Right, they gotta store the foods, right? They gotta have frozen foods, they gotta have canned foods. You have to hey, I need you to be intentional in choosing the ones that are low sodium, right? I need you to be intentional with it and find other ways to make it taste better, right? Because people, when they say sodium, oh, if you take the sodium out, I can't taste it well. You gotta figure out ways to make it taste better without adding additional sodium to your diet, from that standpoint. Patients typically. Nurse Butter says patients typically. let me highlight her pin. Patients typically don't want to hear this, right? Yeah, when we're talking about just blood pressure and just things that you can do to avoid it. A lot of patients don't want to hear that the majority of issues probably aiding to your blood pressure are stuff that you can avoid, right? They love it if I say, yeah, family history, your age, your gender, that you can't really do nothing about that, but that's why you have low pressure. But when I start saying, hey, that cigarette smoking, hey, that diet, hey, your sedentary lifestyle, hey, when you start adding that, they start, doc, I don't want to hear it. So I definitely agree. Patients typically don't want to follow up from that perspective there. Fresh produce is definitely expensive. No, that's the thing. And as a physician, I think a lot of times we typically we'll get lost in that, right? Because we'll be kind of sitting on our high horse telling our patients, oh, just take this medication here and just eat better and just do this and just do that, not realizing Not realizing that I'm telling this person that, hey, I need you to spend maybe, 30% more on food, right? I need you to spend, 10% less time, taking care of your kids and go work out for like, I'm telling you to change your whole life around. And we just say like, oh, you need to do this, and that, and see me in 3 months, right? So we have to be we just got to be very honest with ourselves, right? And I think, again, and I think I blame, not blame, but I think the fact that I do have a public health degree, that when I'm talking to patients, I'm always thinking about like, okay, yeah, I'm talking to this person right here, but like they got family issues. There's a whole community behind them, that this may not be as easy as I'm just kind of like talking to on my soapbox here. Someone said I saw a video that that cholesterol are not bad at all. No, but this is an issue with cholesterol, right? Does cholesterol have a function in our body? Yes, it has a function in our body. As far as get more scientific specific, right? But as far as helping spread messages out, myelin sheath, it has some function. The problem is, just like everything, you can have too much of a good thing. Right. So you can have, when cholesterol does the too much, AKA, hey, I'm producing a lot of cholesterol. I don't know where to deposit it. Oh, let me deposit it right here. And the right here be a vessel in your heart. The right here be a vessel in your brain. Right. And then it just keeps piling. And by the time, next thing you know, boom, you have a lack of blood flow. Boom, we have a heart attack. Right. So it's just one of those things where, like, yes, does cholesterol have a function in our system? 100%. 100%. You can't have no cholesterol in the system. That'd be a problem. But to say that, like, it can't cause a problem is incorrect as well, too, right? So it's just one of those things where it's more nuanced in the conversation. It's, all right, what specific cholesterol we're talking about? What function are we referring to? And trying to kind of go down that path there for sure. Let's see here. Someone said, thank you for having a good conversation on here, opposed to other sensationalist mess. Oh, you're welcome. I only eat chicken and yogurt. Shout out to that. Let's see here. Good question. Lisinopril ARB is the first line for high blood pressure. So, good question. So, in the guidelines, is it starts out with the water pills, right? Because that's usually typically the easiest, right? The hydrochlorothiazide, the thiazide diuretics, again, not to get specific, but usually the water pills, right? We'll just do that, is usually the ones, right? Now, if you have to move on to water pills, like you say, hey, I need something a little bit stronger, because water pills do work great for blood pressure, but they're not the strongest for blood pressure, right? Especially the thiazide diuretics or HCTZs. That's when your ACE inhibitors, lisinopril, your ARBs, valsartan, people mentioned losartan's, another very common medication, especially because it's generic, happens, right? We mentioned misamlodipine, that's a calcium channel blocker, also another great medication for blood pressure. So we got different classes of medications: water pill, ACE inhibitors, ARBs, calcium channel blockers work great for blood pressure. There's some other medications in terms of that help with blood pressure, but that aren't really the best. Now, depending on how old you are, right? If you walk into my office, right? If I had an office, but if you walked into my office and the only medication you were on for blood pressure was a beta blocker, I would know that you're probably like 50, 60 years old, right? Because back in the day, beta blockers were like the first line medication. Just like when I say the water pills are the first line medication, back in the day, the beta blockers were. But we have so much other and better medications for blood pressure that we let beta blockers be like the fourth in line, right? So no one's going to start you on a beta blocker specifically for your blood pressure, right? Usually the water pills, usually ACE inhibitors, usually the ARBs, usually your calcium channel blockers, those kind of fall in line. It's really just a matter of side effects. It's a matter of, because your water pills, your ACE inhibitors, your ARBs, they go and work through the kidney. So guess what? If you have kidney problems, guess what medication I can't give you, right? So they work through the kidney. If you have kidney problems, I'm not say can't give you, but I'm going to be very cautious. I'm going to keep an eye on it. Calcium channel blockers might rise to the top just because of that. But let's say you have issues with calcium channel blockers, you're allergic. Calcium channel blockers, the way they work is because they cause dilation of the vessels, right, which help drop your blood pressure, right? But if you have dilation, aka kind of expanding of the vessels, you can have edema, right? So a lot of patients will complain that they have ankle edema or lower extremity edema from their calcium channel blockers. Some people get reflux real bad from calcium channel blockers, so we keep them off of that, right? So as your doctor, right, we always are trying to figure out, like, okay, I put this over here, but I got to worry about this getting pulled out over there, right? And again, it's a fine science. That's what, that's why they pay us the big bucks to do so. Patients get so angry when we talk about not eating all that salt and quit smoking. Oh yeah, and she's not being hyperbolous, right? Some people will, like, and we're not even talking about diabetes. That's a whole nother conversation, right? But some people, you start telling them what they can't and not do, they don't want no parts of it. They've been eating this way for 10, 15, 20, 30 plus years. They don't want no part of you telling them what they're not going to eat or drink. Right? Oh, I can't smoke? What do you mean I can't smoke? Like, nah, you got, like, doc, find a different way. And those be the patients who typically need 2 or 3 medications because, like, they're still doing the stuff that needs to be modified, but they're not modifying it. So now I have to treat for that too. Like, I have to give you a medication, put a little extra on it because you still smoke, right? Put a little extra on it because you're still taking in a whole bunch of salt. Put a little extra, like, so it's when you see a patient on 2 or 3 different medications, a lot of times it's because the modifying risk factors that they have, they're not really adjusting appropriately or as they can. But, as doctors, we do what we can. We're gonna take care of it right away. Someone said, this is a good question. Why does blood pressure and diabetes often go hand in hand? So that is more of a aspect of, like, genetics, right? So people who tend to deal with issues with high blood pressure typically also deal with issues of diabetes in and of itself, right? Diabetes, I tell people all the time, is not, even though we talk about diabetes being like about the sugar, diabetes is a very vascular disease. Like, diabetes is probably one of the worst vascular diseases that we know of. We just know of it as blood sugar. But when you think about all of the different issues that are affected by diabetes, it's vascular, right? So that's why you tend to see those things kind of go hand in hand, and especially, and then when you kind of tie in diet, right? Boom, like you have this kind of recipe for 2 diseases at the same time. So you see a lot of people, it's not uncommon for a lot of people to be pre-diabetic and have high blood pressure issues, right? Just because of the diet and sedentary lifestyle and sprinkling that genetics, that plays a factor there too. Oh yeah, shout out to hydralazine. We like hydralazine. It's another medication that works for blood pressure. It's usually like 4th line. So it's usually not one of the first medications I may give you. But again, if there's pre-existing issues where I can't give you ACE inhibitors or ARBs when you're pregnant, right? That's a contraindication. I may give you a medication like hydralazine. One of the side effects typically with hydralazine is that it can cause patients to have an elevated heart rate. So that is something we kind of keep an eye on. But hydralazine is definitely a good one for sure. Carvedilol is shout out to Belly. Carvedilol is a very good blood pressure medication. A very good medication just in general. And in regards to the beta blockers, it's one of your stronger beta blockers for blood pressure. Now, again, if you told me, hey, I got to start you on one medication for blood pressure, I'm not choosing carvedilol. But if you're telling me I have to choose a beta blocker, which is carvedilol, to treat your blood pressure, then I'm going to choose carvedilol, if you kind of understand what I mean. So it's not a first-line medication for blood pressure, but if I've gotten to the point where I've got to treat you with a beta blocker, I'm going to choose carvedilol because it works great for blood pressure and it works excellent for heart disease. It's typically a medication we give our heart disease patients, our stroke-related patients. That's typically in that sense there. Someone says, a good question, right? Why is there so many different types of blood pressure medications? Because there's so many different ways to affect your blood pressure. So there's so many different ways to affect your blood pressure, either with me getting salt out of your system, either with me decreasing how much work your heart is doing, either with me working on the actual kidneys, because we know kidney disease and just the kidneys itself deal with about 25% of a cause of dealing with your just blood pressure system, right? So if you have bad kidneys, right, your whole system takes a hit as far as your blood pressure is concerned. So you have to have so many different medications that may attack, I don't say attack, but it kind of is, attack one aspect of why your blood pressure is high than another. So that's why you typically have so many different types. Because again, I may need a water pill, but all right, water pills don't do good for you, for whatever reason. All right, I may do ACE inhibitors, lisinopril. You have the swollen lips after the lisinopril. Boom, that's out of there, right? ARBs, nope, kidney function, get that out of here, right? Like, so you have to have different ways to kind of affect someone's blood pressure because of the different ways that someone can actually have and develop the blood pressure. But that is a very good question, for sure. Yeah, Losartan's a good one. We like Losartan. Like I said, Losartan is good for me because it works great and it's cheap, right? Anything that is great and cheap will always be a positive for me. Someone said they had a heart attack. Blood pressure was 235 or 185. Yeah, it becomes that factor that when your pressure system is so high, right? When the system of your body is there's so much to deal with, your heart just be like, oh, I'm done. Like, I can't do this no more. And it just poop and it comes out, right? So definitely having uncontrolled blood pressure will lead to like the amount of stress needed, right? And the way I try to like visually think about it for my patients, like think about, let's say you're trying to go outside. And someone that is, let's say, we'll keep it with the diet, right? Some 400-pound person is standing in front of the door, right? Is it going to be easy to get out that door or harder to get out the door? No, it's going to be harder, right? So you're going to have to force and strain yourself to try to get out that door. But if someone is 100 pounds, right, and they're standing in front of the door, yeah, you're going to move them right out the way, right? So when you think about dealing with blood pressure that is 235, that's like that 400-pound person sitting in front of your door, right? And they not moving, and they're forcing you to have to try to work all your strength just to get through them, right? And a lot of people cannot, I'm gonna have a heart attack. I'm gonna have a stroke, right? A lot of people cannot deal with that. And when your blood pressure is 235 or 180, guess what's also taking a beating? Your kidneys are taking a beating. I think we said last week on the show, number one and number two causes for chronic kidney disease and patients ending up on dialysis is high blood pressure and diabetes. Right. So again, your kidneys are consistently taking a beating, consistently trying to get past this 400-pound person that's in their way and is having to work until it can't work no more. And once it can't work no more, boom, all of a sudden you come to see a nephrologist because you need dialysis. Right. So definitely, yeah, it's important for sure from that standpoint. Yeah. Oh, some blood pressure cause issues. Yeah. Oh, yeah. Vision. I mean, vision issues of itself, right? It's when you have such strain in the body, right? Which is what blood pressure does, right? Again, it's a silent killer. So it's not like it's letting you know, like it's straining you. It's just slowly straining the systems in your body, right? The eyes, a lot of blood vessels in your eyes as well, too, right? So if, again, that same issue, if the blood pressure is so bad, guess what, right? Like, I'm gonna run into problems in and of itself, and you can definitely have some vision issues or concerns. Again, blood pressure and diabetes. Again, like it'll be like a broken record, but blood pressure and diabetes also affect vision. Probably like the number one and number two causes for vision loss worldwide, as well. Let's see here. Shout out to Miss Sarton. Opinion. Oh, this is a good question, right? Because it comes aspect of kind of testing, right? So the way we look at any of these testing, right? Even when I'm mentioning, Publix, Walgreens, and all that, it's not like their blood pressure cuffs are so amazing. The reason why we want you checking it is we want you to have some type of consistency as far as what your numbers look like. So if you have the wrist cuff monitors, right, and you're taking your blood pressure from the wrist, because trust me, they do this in the hospital all the time, right? If like say you're a really big person, they really can't get, like they'll put a blood pressure cuff around your foot, right? So like we're gonna try to get some blood pressure, right? And we just have to, from a clinical standpoint, say, okay, based off where you got the blood pressure, what am I gonna do with that? Right, so wrist is not bad at all. Especially, it's just a matter of getting a consistent blood pressure, like, all right, every morning I check, my blood pressure is in this. Every evening I check, my blood pressure is this. So yeah, definitely a fan of the wrist cuff monitors, because again, that just helps you take it at home, and it's easier, right? Because for those, especially if you got blood pressure, you need a whole second person to kind of wrap it around your arm. Now you can boom, I put it around my wrist, and I relax, and then I just let it go. So definitely a fan of that for sure. Let's see. Oh, someone said, don't take advice from a DO. I'm sorry to hear that. Sorry to hear it. Let's see. What we got that question. This is a good question. Amelia asked, is there any BP cuff specifically? So there's nothing specific, right? So if you have someone, especially if you have a partner at the house who can help you do it, we prefer you getting the ones that go around the arm, because that's typically where you get it. Typically where we test it, right above the elbow. But let's say you don't. Let's say you're by yourself, right? You don't have no one to consistently check it. The ones that right around the wrist are good money for me. Very good money for me for sure. Pain for sure. With Nicole's hitting it tonight. Pain automatically raises it. Oh yeah, which is, and that's why it's so important for us to kind of know, all right, what is going on. Right? Like, why is your blood pressure, the way it is, right? Is there like obvious reason that we can say, oh, that's why your blood pressure is high, right? Because again, we don't want to write lisinopril and water pill medications all day unless we have to, right? We don't want to do it. So we got to figure out, like, all right, is there underlying factors that may be associated with your blood pressure from that standpoint there? Let's see here. Kevin says wrist ones are inaccurate. Yeah, no, like I said, it's again the accuracy is one of those things. It's just more consistent. Like, 'cause if you have a wrist one and your blood pressure is always high on the wrist one, all right, your blood pressure is gonna. And then you check it in Walgreens, it's high over there. All right, yeah, you got high blood pressure, right? So it's just more of a matter of just finding a consistent process of checking your blood pressure. Now, again, I don't want y'all to, especially if you don't have any medical issues, I don't want y'all to have to check y'all every single day, right? But like checking it consistently enough to say, like, oh yeah, when I checked my blood pressure that time, it was so and so from that standpoint there. So a very, very good question. Let's see. Shout out to the raw vegans are in the building. Like I said, we love the vegans, and I'll tell you. And then someone said Western diet, right? So I will tell you. When it comes to nutrition, and my nutritionist will definitely tell you as well too, right? Your doctor likely isn't the best person, right? They likely aren't the best person to talk about nutrition unless they were really gung-ho about nutrition, right? Because most medical school curriculums may have like a 4-week class. Hey, this is what you need to know about nutrition. And then we go to residency and we definitely don't talk about it. So anytime you can get an expert advice on nutrition or someone who really focuses on that, always lean towards that more than anything else. Because again, our training, focuses us on, knowing that lisinopril and ACEs and ARBs, and like we do a good job over there, but we don't do a great job over there. And someone's mentioned about the bad diet and Western diet and everything else. Yeah. Like it plays a factor. It plays a factor for sure. When you have certain foods that they won't even serve in other parts of the world, but they serve here fine, right? Like I would have to be silly not to assume that our food is playing a significant factor. I would just have to be silly, right? And we're not silly over here. Let's see here. This week is a quick. Now, someone said I'm on 3 different blood pressure meds: spironolactone, amlodipine, propranolol. Why? That I'm not sure. Right now, I can't tell you that those are 3 different blood pressure medications. Spironolactone not necessary for blood pressure. Typically, when we think about spironolactone, it's usually for like heart disease and patients who suffer from heart disease or suffer from liver-related issues. That's typically when we're thinking about spironolactone and propranolol. So I'm not sure necessarily why. So again, spironolactone is there, but it's not necessary for blood pressure. It does kind of help with that process, but it's definitely not one of the medications that I would put you on if you had high blood pressure issues. But if you have heart disease, there is some cardioprotective factors associated with spironolactone. Propranolol is another one, cardioprotective factor, but not necessarily great for blood pressure, which isn't uncommon. You could be on a lot of different medications that, yeah, they also work for blood pressure, but they're not giving it to you for blood pressure. And that just more, you got to talk to your doctor to figure out why they chose that combination than the other. I love this. Like Haley says, talks about kind of some of the outside factors, right? So we mentioned how blood pressure issues play a factor. We mentioned how diabetes, cholesterol, thyroid, kidney function, sleep apnea is a huge one. There are a lot of people with uncontrolled high blood pressure, and it's because they have undiagnosed sleep apnea, right? And we could probably do a whole discussion on the sleep apnea in itself. And sleep apnea has been definitely one of the more, I say, popular diagnoses of the past maybe decade and a half, where you have a lot of doctors who are focusing and specializing in sleep medicine. Like that is how significant it's become a part of our system. So yeah, definitely uncontrolled sleep apnea will definitely play a factor, right? You can be on the best medications, but if your sleep apnea is not controlled, not regulated, it don't even matter. So yeah, I'm definitely glad you mentioned that from that perspective there. Let's see. I don't think this is a good question, right? And about the hour. Oh, nice. I don't think it's ever a bad idea, right, to incorporate plant-based diet. Now, am I saying you should go full plant-based diet? Like I said, I ain't a nutritionist, right? I can't recommend something that I won't do. But like I know people who have benefits from it. So it's just really a matter of, hey, what is my diet like? What is my nutritional intake? What are things that I can replace or kind of take in that may be a benefit, right? So again, maybe not 100% plant-based, but maybe, you incorporate it 2-3 days out the week, where, you have a lot more plants, especially if you're already deficient in getting it with your typical diet, from that perspective, right? So again, definitely agree that some plant-based diet is beneficial, but I think a lot of that is because a lot of us are very deficient in the things that we would typically get from a plant-based diet. Like this, just by nature, we're deficient in that from that perspective there. For sure. Make sure we know. Someone said, I just skipped a question. Someone's asking about beet root supplements. I'm just not familiar with it, but if it works, I'm with it. If it works, I'm with it. Let's see here. Make sure we don't miss anything out here. Oh yeah, all right. Let's see. I'm not familiar with Sassy asking about the GLP medications. Blood pressure. I'm not familiar with what GLP medications you're referring to. Let's see. All right, man. Yeah, Dash diet is better than vegan for high blood pressure. Yeah. Well, Dash diet again just kind of helps with that low sodium. It's actually a very good question, right? So someone says, when is it best to check? I like for my patients to check in the morning and then in the evening. But like it's really a matter of when can you check it consistently. If you can consistently check it in the evenings, like all right, let me get my 7 p.m. blood pressure on. Boom, let me write it out for a week or so, then I'm cool with that. But because if you have high blood pressure, whether you have it in the morning or evening, you're gonna catch it. So it's not as if like, oh, in the mornings it'll definitely be high, but by the evening time it'll cool down. Like if you have it, it's gonna be high. So whenever you can check it, but like I think mornings are great, especially because we can kind of factor in like, all right, what type of medication should I give you? Right? Maybe I give you a medication that, that instead of once a day, it's a twice a day medication that cover you over the nighttime. So it's just a matter of your doctor may want to do it just to kind of guide their game plan. But from the standpoint, whichever one you can do consistently is always good money for us. Let's see. So we'll get a couple more questions. We'll get this question here. So we'll do two more questions, then we get up out of here. Are the symptoms that are not so silent that someone could look out for? So when you're dealing with high blood pressure, some of the biggest issues that, again, before we get to you have a heart attack, you have a stroke, typically people get headaches. Typically people get vision, and someone kind of mentioned how they're they had some vision issues, so blurry vision, double vision. You'd be surprised how many optometrists will diagnose a patient with high blood pressure or high cholesterol when they do their eye exam, right? So because they see it in the eyes. So vision issues, chest discomfort, chest pain that just kind of like waxes and wanes. Some people can get short of breath, especially if the pressure is very high. So those are some of like the and easily winded as well. Like, so if normally you're able to walk down a block with no problem, but now half the block, you're kind of feeling winded. Definitely some concerns there that you want to just make sure your blood pressure is in control of for sure. Which blood pressure medications affect your kidney? Typically, the ones that we are pretty keen on are your water pills, your just the diuretics in and of itself. I'll just leave it as diuretics. Diuretics, your ACE inhibitors, and your ARBs are typically the three that we're like, oh, you got some kidney issues. I need to either keep an eye on it or don't even put you on it completely. And someone says, why is atenolol so bad? So atenolol, and we'll leave this for the last one. Atenolol is not bad, right? It's just what it is that if you told me to list the medications to give you for blood pressure, right? Atenolol is going to be like 5th place, right? But if you tell me, hey, I'm on atenolol for blood pressure, that means you've been on atenolol for a while, because atenolol used to be one of the premier medications for blood pressure. So this is one of those things where, like, yeah, it works for blood pressure, but like I got so many other better, cheaper options. Well, not cheaper, but like, because they're all cheap now, most of them. I got so many better options that it's never going to be the first one. So is it a bad medication? No, but it's just not one of the first line medications for blood pressure. Because again, that whole class, beta blockers, is just not the class that I would treat, especially if I'm treating for blood pressure. Now, atenolol works great for people dealing with palpitations, like feeling like their heart's racing, feeling like having tachycardia, especially when their heart's above 100. So atenolol works great for those patients. But if I'm talking specifically for blood pressure, I ain't here. It's never for atenolol to do for me here. So, all right. It's been an hour, right? I'm actually, like I said, like y'all asked for a hypertension last week. And I was like, oh yeah, we can talk about hypertension. I don't know how many people want to talk about it. I'm actually surprised a lot of people really want to talk about high blood pressure. Shout out to y'all. I think next week we could do, I feel like, because I know a lot of people kind of mentioned diabetes. Like, I think diabetes might be one to kind of harp on, right? Because it's some issues in of itself, right? So let's focus on, we'll do diabetes. But leave it in the comments, right? If you want to, think of something else you may want to talk about, or obviously follow the page. If you missed any of tonight's episode, I actually post this live on my YouTube channel. It will be up tomorrow morning, so it'll be up there tomorrow for those who catch it. If you check my pinned folders on my TikTok, I actually have like an infographic, a hypertension infographic. That's where you can go get that as well too. But y'all be blessed. Y'all have a great evening. Stay safe. And I'm going to see you guys next week.